Para pak ditëve Prishtina u bë qendra e mjekësisë moderne, Acibadem Sistina, me mjekët e saj, me emrat më eminent të mjekësisë të cilët punojnë dhe veprojnë në Acibadem Sistina. Në Shkup kanë ardhur në Prishtinë për të mbajtur një event ligjërata nga rastet e pacientëve të tyre, mjekë të fushave të ndryshme të cilët kanë paraqitur rastet e tyre para mjekëve tanë. Prezent ishin mjek nga fushat të ndryshme, gastroenterolog, onkolog, kardiolog, kirurg, plastik e fushat të tjera, gjithmonë duke potencuar që eventi është organizuar nga Imperium Klinik, një organizim të themi perfekt, ku nuk munguan as mjekët tanë të cilët me kurreshtje ndëgjuan ligjëratën, por nuk munguan as mjekët më të mirë të Acibadem Sistina. Nga kardiologjia, pulmologjia, urologjia, neurokirurgjia, kirurgjia pediatrike, onkologjike, radiologjia intervenuese, dermatologji, kirurgji plastike dhe estetike e fushat të tjera të cilët ligjëruan para mjekëve tanë në Prishtinë.
Good morning, welcome. Just a short welcome to you. It's good to have this meeting, being together with you. You will be having our doctors presenting what we are doing. Okay, now thank you for this conversation. And Acibadem Sistina, we are here today in Pristina to make some collaborations. And you know, we are a 15 years old hospital. And we are doing some new technologies, and we have good talented doctors working with them, and so we just wanted to make a presentation what we are doing and doing collaboration with the doctors from the region, not only from Pristina, from all regions, Albania, Croatia, maybe, and Macedonia. And this was a good opportunity to be there here and meet those doctors, the colleagues, and making the collaborations and explaining what we are doing in our hospital. And as Acibadem Sistina, we are always in a way that following the technologies and implementing them to our hospital to treat the patients, and this is very important. I mean, medicine is always, healthcare is always developing, so it's good to follow up everything. So it was the aim that we came here to make this collaboration with the colleagues and the doctors. And thank you for this conversation and this meeting. And it was I think it's very helpful to meet all those colleagues from different departments. I mean, you know, we treat patients as doctors. I am the head of the hospital, CEO of the hospital. I'm also a medical doctor. It's good to collaboration. I mean, when you do something new, something good for the patient, it's good to share this with another colleague, and this gives them the opportunity to hear the doctors here. So, and in this way, they can collaborate and ask what we are doing, what they can do, and for the patients. And making this collaboration will, I mean, develop the procedures and the treatments that we do the patients. And this is very, in a medical way, it is also good, and to know each other, what we are doing, what they are doing, it's good, I think.
Good afternoon, and thank you for giving me this opportunity to share our experience with something that we are doing last years in our hospital as a type of treatment for structural problems of the heart in adult patients. So the most frequent problems comes with the most frequent disease between the human beings. It's cardiovascular problems. Cardiovascular problems are due to the risk factors for atherosclerosis, like hypertension, dyslipidemia, and other problems, and controlling those major risk factors makes the big improvement in healthcare of the whole nation, not only the cardiovascular problems. So it means the most frequent disease is hypertension between the adult population.
Regarding these urgent problems that we are treating and cardiology is dealing with is interventional procedures in acute coronary syndrome. I mean myocardial infarction, non-stable angina, and vascular problems or carotid stenosis, preventing strokes, treating patients after stroke. So we are dealing with these problems. Other part of the cardiology problem that we are dealing is electrophysiology. So it means problem with the heart rhythm. And this is different part of cardiology, and we are covering the whole aspect of this. Imaging techniques using ultrasonography, transesophageal echo, we are using to find structural problems of the heart and treating valvular problems. So we are dealing with, and today we presented TAVI procedure, very, very frequent procedure that is growing everywhere in the world, also in the region. I mean aortic valve replacement without using surgery approach. So all these problems are treated by cardiology team, and we are divided in 3 different groups, and we are dealing it with approaches like a team approach, also collaborating with cardiac surgeon. Prevention of cardiovascular disease is a national program of all the serious governments because it's, as I mentioned, it's the most frequent part. So good prevention means that the problems will appear much later. So much later means that we have better quality of life, we have better society, we have better planning of the economy and not only the healthcare system. So it means it's very important for all the government to plan prevention in the cardiovascular disease. This is probably the most important, together with oncology prevention. It's most important for every government. So it means not only in our region, all around the world. In last 20 years, life expectancy in patient is 7 years older due to the good improvement in prevention. So prevention means smoking cessation, good control of the hypertension, and good control of the level of cholesterol. This is the most important part of prevention in the healthcare system, not only in cardiovascular medicine. First of all, the most important is team approach. So team approach means that we are approaching the problem from the correct parts of the medicine. So it means never putting one in first or second place. We are putting in the first place the patient. So it means when we have a patient, different type of specialists are approaching. So it means cardiac surgery, cardiologist, different type of cardiologists, as I mentioned, and at the end it's a team approach that guarantee the best treatment, not only in the region but also wider. The most frequent symptoms they're presenting is problem with the heart rhythm. They feel that something is going wrong. Breathless, so they are losing their power, they are losing their, and in most severe cases there is a chest pain. Chest pain means that some type of pressure in the region of heart is something that force the patient to reach the hospital, to reach the cardiologist for asking. Then we appear with a team approach, so it means proper diagnosis in shortest possible period and proper approach for treatment. Unfortunately, the whole region is facing something that is not very typical for the other regions. So the high level of stress, uncertain future, and a lot of problems in the last 30 years in the whole region made our region unique. So it means we are facing more and more young patients suffering serious problems with the heart, I mean heart attacks, etc., etc. So it's completely different in the other regions. So probably a lot of stress is in our everyday life. I mean uncertain economy, problems with our history, with wars, with everything, provoked not very healthy style of life, and this is where we should be focused in the future.
Ndryshim endoluminal, ekstraluminal ose të kombinuar, kemi analizë domethënë terapeutik, që pari përdore domethënë endoskopia rigide e kombinuar me determinant mekanik, paraprakisht përpunuar domethënë indi me metoda termike, siç janë ato plazma, koagulimi, laseri, elektrokauterizimi, krioterapia, radioterapia, deodacioni mekanik edhe kombinimi i gjithë metodave.
Unë sot kam ardhur me një kënaqësi të veçantë me taku doktoriston Simonov, një prej doktorëve cilë e ka shpëtu vajzën time nga një dëmtim kockuar, i cili ka ndodhur gjatë skijimit ose tentimit për me mësu me skiju. Vajza ime në moshën 7 vjeçare ka thy këmbën, edhe ka qenë vikend. Gjatë asaj kohe, si prind, shqetësimi ka qenë shumë i madh, po ashtu edhe dhimbja te vajza ka qenë shumë e madhe, se dihet se koç ka dhënë shumë. Dhe në atë kohë vikend kam tentu me gjetë zgjidhjen sa më shpejt. Duke qenë si përkes fushës mjekësisë, jo humane, por veterinere, e kuptojsha se çfarë problemi është dhe çfarë nevoje ka vajza. Prej vendit ku e theu këmbën, kishte aksidenti, ne shkum, aksidenti ishte në Mavrov, shkum në Gostivar me bo një rentgen, ata na pranon shumë mirë, dhe në rentgen e pash që me patjetër duhet bëhet operimi. Me disa këshilla të disa mjekëve tjerë më propozum me bo gipsimin, po që unë duke njohur pak fushën dhe ostologjin përgjithësi, e pash që problemi dhe thyre nuk ishte për me bo gipsimin, por u deshke me bo operacion. Me një miktimin në Maqedoni që kam, provu me gjithë lidhje përmes ti se kush mund ta operoj dhe në lidhjen e parë pata fat në lidhje aj përmes një shokut ti me kirurgun e fëmijëve doktor Riston. Doktor Ristos ja spjegova komplet rastin, ja dërgova fotografitë e rentgenit si ishte thyrja, moshën e vajzës dhe çdo gjë sa i përket historisë ose anamnezës të problemit dhe me urgjencë më pranoi me bo operimin e vajzës. Vajza është operu nga doktor Risto 48 orë pas thyrjes dhe sot gëzon shëndet shumë të mirë. Operimi është bo me metoda moderne, nuk ka shenja të mëdha të operimit. Operimi ka qenë jashtëzakonisht i suksesshëm, vajza është shumë e lumtur, ne si prind jemi shumë të lumtur, edhe përjetësisht jam falënderues doktor Ristos për atë që ka bërë për vajzën time, jo vetë sot, po gjithmonë doktor Ristos jam në dispozicion me qenë në shërbim të tij ose në një falënderim për atë që ka bërë për vajzën time. Gjithashtu, fani e falenderoj edhe Spitalin Sistina që ka bërë kujdesin maksimal për vajzën. Ashtu ishte fat që rash në dorët e doktorit edhe jam shumë i lumtur për përfundimin dhe rezultatin.
Is divided in 4 big stages, like the vascular intervention radiology, non-vascular, neurovascular, which is separate subspecialty, and one of the newest is the intervention.
Trakea, bronket principale, bronku intermedial dhe gjithashtu të janë të përfshira edhe bronket lobare. Obstruksioni do të jetë mbi 50% që të jetë pacienti kandidat për tretman endobronkial. Obstruksioni mund të qenë obstruksione të brendshme, obstruksione nga jashtë ose shtypje e murit të bronkës së trahezë nga jashtë, edhe obstruksione të kombinuara. Dije se obstruksionet shkaktojnë probleme të mëdha, mund të shkaktojnë.
It was a very beautiful girl named Zerina. She was in that time 7 years old, and she has a very bad fracture of the lower leg of both bones, but tibia, the bigger bone, was very bad fracture with 2 parts, with 2 fractures on that bone, and the case was very urgent. We done preparation in short time, about 1 hour, and shortly after preparation we done operation with minimal invasive surgery, a fixation with both ender nail, intramedular, inside in the bone, under X-ray. Operation was passed very successful, and after 2 days we discharged Zerina at home. And as I know from her father Dardar, now she is a big girl and she is successful in his life. In Sistina we are preferring all pediatric surgery, all pathology from pediatric surgery, from general surgery, urology, trauma, plastic surgery, oncology surgery, neonatal surgery, all pathology from pediatric surgery, and we prefer minimal invasive treatment, because for child, also for parents, it's very important to be on their legs as soon as possible. Yes, this kind of treatment, minimal invasive, on this region, I think it's only in Acibadem Sistina Hospital.
Came best as portable stomach of our department. We're using the most modern approach of treating the fractures and the disease without
Even the neurosurgery is really complex medical science. Here in Acibadem Sistina, we are treating the most difficult cases. This is why it is, because we are a private sector, so all the cases that cannot be solved in the public sector are coming for a private sector for second opinion, and usually they are staying here for the operations and for the treatment after that. So we have a lot of different cases. In the last year, I would like to emphasize that we had a lot of brain tumors, and we are not happy because there are a lot of brain tumors, but it's good that they came to us and we provided them from the diagnostics, from our neuroradiology center to our neurosurgery department where we do the operation, and then we are sending them to neuro-oncology where they can do true beam or chemotherapy, and we are rounding a process of healing one brain tumor. Also, we have a lot of difficult spine cases that are coming to Acibadem Sistina for stabilization and fixation specifically. So we are also proud that we can do that in minimal invasive manner. And since the beginning of the year, we are also doing brain biopsies, and nobody in this region is performing those brain biopsies. Those are three aspects that I would like to emphasize, and we are happy about it. Yeah. From two aspects, if you consider the medical aspect, I can say that this lecture and this communication with the colleagues here in Pristina, it's really useful for both sides, because on the one side I can see what types of neurosurgery are done here in Kosovo, and on the other side I can present that really near Pristina, on 1 hour drive, we have a really modern and up-to-date neurosurgery. So in both ways we have a really good communication, and we both learn from each other. The neurosurgery department is known that it's really dependent from new technologies. Neurosurgery as a science is really dependent from new technologies. So we are trying every year to introduce some new, I can say machine, but today machines are also going with artificial intelligence and robotics. So we are introducing robotics right now. So we are really dependent from the new technologies and from the science breakthroughs. The patients are usually coming directly for treatment, but with help of these conferences, we are starting to have a communication with our neurosurgical colleagues here in Pristina. So we have a change of opinions, let's say. So usually our patients coming to us for, let's say, more complex surgeries and for the things that cannot be done at the moment here. But the good thing is that we started to have communication not only with the Ministry of Health here, but also with our colleague neurosurgeons. Usually headaches are the first symptom, but not everyday headaches that every one of us have here. Severe headaches that you cannot get up from the bed, or you can you start vomiting, you start having vertigos, you cannot stand on your feet. Those are the three major symptoms. But also, because a lot of viewers will see us, it's not like we experience it every day. These signs should have to be severe, so we can go to the neurologist or ask a neurosurgeon for opinion.